Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at Papago Park, specifically the amphitheater at the park. The park amphitheater was built in 1933 by the Civil Conservation Corps, and it used to be used for concerts, community events, Easter sunset services, but over the last 50 years it has not been used much, except for people like me making videos talking about why it's not used much. The reason is McDowell Road. McDowell Road is a very busy street going back and forth east to west from Scottsdale into Phoenix, and Tempe is sort of down in this area over here. So it just kind of ruined the vibe of having the events. At any rate, the topic for today is how to avoid spinal fusion surgery. So spinal fusion in this country has undergone an exponential increase in usage and popularity. For instance, between 2002 and 2007, 5 years, 15-fold increase in spinal fusions around the country. We didn't have a 15-fold increase in population. We also didn't have a 15-fold increase in the specific population of the baby boomers. So there's a much larger increase in the usage versus the rise in the population. So then the question is why? And most likely it's because of increasing utilization, finding it out that it works maybe for additional diagnoses. Or there could be some secondary gain. So what does secondary gain mean? Well, there's a recent study looking at the usage of one of the bone graft substitutes in fusion, and the surgeons that were working on the study to approve that bone graft. Well, they didn't exactly report all the adverse effects. There was a lot of money paid to these surgeons. So the Wall Street Journal just came out with a big article about it. So when you're looking at spinal fusion, it's not clear-cut as to the indications for it. But let's talk about ways to potentially avoid it. If you're having a spinal fusion for an elective condition, meaning degenerative disc disease, or a degenerative spondylolisthesis, a little bit of a slippage from arthritis, something like that where it's not absolutely necessary, then you can look at ways to avoid surgery. One of those is physical therapy. Physical therapy can help strengthen up the muscles around the back, helping taking pressure off of the spine. So if you have a disc that has some tears in it and causing pain, if you take pressure off of that, then that can really help. Another thing that's been shown to help avoid spinal fusion for degenerative disc disease is aerobic exercise. Whether that's swimming or cycling, probably should stay away from running, but so, non-humongous weight-bearing activities can help substantially. Most patients who have degenerative disc disease do not end up needing surgery. We're talking about less than 5% of those who have it and have pain from it. They can usually avoid it. So you have aerobic activity, physical therapy, chiropractic treatment can help. Research shows that, especially for acute pain. It can help settle the pain down and get patients back to their baseline. So there's also a treatment called spinal decompression therapy, which we have at Preferred Pain Center. It can help dramatically decrease pain. It's non-invasive, it's very safe, very minor risks. Most patients fall asleep on the table. It's very cost-effective. It costs less than 5% of the cost of a spinal fusion surgery. So moving away from there, there are certain medications that can help. You have non-steroidals that are over the counter, you have Tylenol. There are some non-addictive opioid type medications like tramadol that can be beneficial. Low doses of narcotics, maybe Lyrica, which is a neuropathic medication if you're having pain down an arm or a leg from a scarred up nerve root where spinal fusion is not going to really help for. So those types of things can be very helpful. Interventional treatment is the next one. Now you can have methods of interventional treatment that have expanded in recent years to include, epidural injections, facet blocks, F-A-C-E-T, and those injections can include corticosteroid, maybe a regenerative substance, which is amniotic fluid based that we offer, which doesn't have steroid in it. There's also radiofrequency ablation procedures, which can be extremely beneficial and can give upwards of 2 years of pain relief. And then sort of the big daddy step, if you really surgery is not a great indication but you have a ton of pain, is a spinal cord stimulator. So I've done videos on all of those individually, but with regards to trying to avoid surgery, well over 95% of patients at Preferred Pain Center are able to avoid surgery by having a customized treatment program utilizing these options. Every patient is different. Their pain is different, and the way they got into pain and how they look at their pain is different. So they need to be treated individually. And that's what our providers do at Preferred Pain Center. So we have a 24-hour guarantee. We'll get you in within 24 hours. We also have a free massage for new patients, half an hour. And in addition, there is a ton of information on our website at preferredpaincenter.com. You have multiple videos, narrated animations. There's a very active blog. So check us out today or call us at 602-507-6550. I'm Dr. David Greene, Preferred Pain Center. Your pain stops here.